The following is a local resident producer's program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of CATV2, Oshkosh Community Media Services, the City of Oshkosh, or Time Warner Cable.
Hi everyone, welcome to Eye on Oshkosh. Cheryl Hentz here, and Dan Rylance is away this evening. He's out of state, but very pleased to be joined by a guest co-host tonight. Yeah, I'm sure you recognize him, Alex Hummel from the Oshkosh Northwestern. We're very happy to have him, and I think he's happy to be here. We'll see if he's still happy in an hour.
I am. I will be.
So anyway, thanks very much. And our guests this evening are two folks. One I'm sure you recognize as being Gordon Hintz. He is the Democratic Assemblyman in the 54th Assembly District and seeking re-election, seeking his second term actually. He's currently in his first term. And his challenger, Republican challenger Mark Reiff, is here also. So thanks to both of you for being here as well. You're an old hand at this, but Mark is a newbie, so we'll take it easy on you.
Thank you very much, ma'am.
Contrary to what you may have heard about us. So anyway, we always start by having candidates for political office just tell us a little bit about themselves and why they're running. In this case, why you're seeking re-election, Gordon, and for Mark, why you're throwing your hat in the ring. So go ahead and start.
Sure. Well, I was elected 2 years ago, and one of the things that I pledged to do was to work with the community of Oshkosh, be someone that was going to fight and stand up for Oshkosh and identify a number of areas where as a state representative, I could help increase state support for a lot of our local institutions, whether it's the university, the school district, the city of Oshkosh, the county. And being someone who lives here and is invested and concerned, I've built those relationships over the last 2 years. We have a lot of challenges right now as a state, as a nation, probably as a world as well. And as one legislator, it's oftentimes difficult, but I do see that we need to do a better job of addressing the long-term challenges that we have. I've maintained my commitment to campaign finance reform, to moving the economy forward by investing in the skilled labor that we need in the university system, and by identifying a number of areas where I feel like, whether it's funding for Miller's Bay to treat the weeds, or neighborhood redevelopment funds, where I've been able to support the community in a way by being knowledgeable of those issues. And a lot of what you do between Oshkosh and Madison is mediate between the two. Advocate for your community down in Madison, but also come back and share sort of what's happening and try to find a group of, talk to businesses, talk to the doctors, talk to the hospitals, talk to local government members, and try to explain, what's happening and what might happen down the road. And, that's one of the things I think I've done successfully, and I'm in a position to, take those issues further. But I'm committed and, looking forward to continuing to move the state and the community forward.
Okay, Mark?
Well, a little bit of background on myself. I was raised on the south side of Oshkosh. My family moved here when I was 7 years old. The reason that I'm interested in running is basically because I've always been interested in the political process. Unfortunately, there were a few years there at the end of my college experience where I was so disenchanted with what I had seen in politics that I was uninterested in pursuing it any further. That all kind of changed after I'd done a few years in the Army. I went because our country was at war and I felt it needed to be done. And one of the things that you learn in the Army very early on is that anyone who is not helping to solve the problems is part of that problem. You can't simply sit passively by when bad things are occurring. The problem that I see occurring in Wisconsin right now, there's myriad, but the top problems I see would be the budgetary issue that we have. We continue to run up a greater debt every year. We have rising health costs that makes it harder for people to maintain their insurance. We have an energy crisis. We've had a doubling in energy prices over the last 10 years, and we certainly are going to see those go higher. And lastly, I think we are losing a lot of our basic business and infrastructure that have always kept Wisconsin and Oshkosh employed and livable. And these are all issues that need to be addressed. And I felt that as I've served in the past, I must continue to serve and do what I can to solve these problems.
Okay. What makes you a Republican?
Well, basically, I've been asked that on a number of occasions because I do have certain tendencies away from the party. I really am fairly independently minded. What makes me a Republican versus a Democrat is that I do not feel that the Democratic Party actually has the language to address small government, which I think is very important. Realistically, the problem that we have is not that the state is not doing enough. It's that the state feels that it needs to be involved in every single step of every process, and that is disadvantageous.
Okay. And by the way, thank you very much for your military service.
Thank you, ma'am.
We appreciate that. Gordon, what makes you a Democrat?
Well, I too am a Democrat who has an independent streak as well, and I think also it's more complicated depending on what part of the state you represent. But I'm someone who's always believed in opportunity, equality, that there's a positive role for government to play, especially now than ever. There's a role for government to play when there's market failure, and we've seen that whether it's in the foreclosure market, in fuel, and in healthcare. When you have situations where people that have been healthy their own lives are guilty of being 59 and unemployed, and the private insurance market won't insure them, there's a role to play. So, it's sort of those core values that have been themes throughout, in the Democratic Party that made me who I am.
Okay, go ahead.
Let me ask a broader question here, and it deals with economics, economic development on a local level. You're both going to represent, if you're elected, a city in Wisconsin, pretty much. That's your district.
Yes, sir.
Just the other day, we learned of that city's major key corporation, the Oshkosh Corporation, announcing 600 layoffs globally. It's a huge company. Nevertheless, a troubling trend, I'm sure, for many workers here and abroad that belong to that corporation and work for that corporation. We've heard about New North. We've heard about other economic programs. We've even heard some legislators in Madison talk about there's just too many economic development programs. What can an assemblyman do to really help his home district grow jobs, diversify its economy? What specific things can you do? Because that seems to be one of the biggest challenges facing local government, local residents, the school district. That's a big one. What can you do?
Well, I'll start. I think, one of the things that government really doesn't do a good job at, whether it's local, state, federal, is communicating what the real choices that we have are. And it's clear, I think, in becoming more clear to people that we're in a global economy, and that I can't just wave a magic wand to correct some of these things, and that we're not just competing against other states, we're competing against other countries who do have fewer environmental standards, no labor standards. But you gotta have a vision to where you want to go. Government's very good at making short-term, politically expedient decisions. And we need to look longer term, and we also know we need to diversify our economy. We know that skilled labor is one of the biggest challenges, and that's another role that government can play, whether it's through higher education or our technical colleges, which already have been good. I mean, the manufacturing that we have maintained here is largely because we are better at high-end stuff. We are more productive, and we've incorporated a lot of technology. Tom Still from the Technology Council briefed us in Madison on Monday about that we actually have seen some new growth, and we've passed over a number of other states in the last 4 or 5 years, especially in areas like Milwaukee that haven't had what Chicago and Minneapolis have. But we got to bring everybody up to speed that we can't just sit still, and we're going to have to change how we think about ourselves. We need to modernize our education system from early kindergarten through college. But the days of getting that job at 18 and retiring at 60 are done, and it's about retooling, retraining, and making us competitive again. But there's not a silver bullet, but we need to have a real conversation about it.
I mean, let me interject here, Gordon. I mean, that's a good answer. You touched upon a lot of the things, but this issue is going to keep coming up, especially as local governments are forced to grow to survive and maintain programs and grow programs and grow service. I go back to my original question. What specifically can an assemblyman or a legislator do? I mean, how do you get your hands around this and help your home district improve itself? And I'll let you answer that
Sure, and
question first,
I'll
and then
be
we'll get
brief.
back
I
to
mean,
it.
again, a lot of it's been by tapping into, the existing businesses we have and being aware of those things. But look, Madison's a place about pushing ideas, building support. I'm a one vote. I need 50 votes to get anything passed and then move it through the Senate. But you're trying to drive ideas. You're trying to interact with people at all levels on what the challenges are. But you try to establish business practices that use efficiently the limited resources that we have, and make sure that we're doing the things that encourage new jobs and new growth. But as one person, you beat that drum as loud as you can, but also try to see the end game.
Well, I would agree that we definitely need to look at business diversification. Unfortunately, as you were mentioning, Oshkosh is largely employed by two major employers, Oshkosh Truck and Bemis. Many of the other employers in the area are orbiting those two major ones. So we need to look at what other things can be brought in. One of the problems that we have as a state, and Oshkosh, of course, falls into it because of the fact that we are located here, is that we are considered to be a fairly poor business climate by many people at the national level. No one wants to move to us for a whole host of reasons. We have a poor tax structure. Our corporate taxes are high compared to most places, and
39th
we're 39th.
out of 50.
And we have a lot of tax exemptions that we've put in to try to attract specific businesses. Perhaps what we need to be looking at is simplifying and streamlining that tax structure, and so that we can bring in more revenue from the existing businesses, but simultaneously lower the overall rate so that we become more attractive to all businesses. Another thing I think we need to do is look at our regulations. We are very much regulated in this state compared to most states. We could try bringing some of our programs and regulations into alignment with surrounding states and the federal mandates. In fact, perhaps that's a place that the government could really assist, would be as a facilitator, so that businesses will be able to have a streamlined process rather than having to continue to file more needless paperwork over and over so that they can get a business off the ground. Another thing that we could do that we have been failing recently is in the infrastructure department. Wisconsin has failing highway systems, and we do not have the industrial rail system we once had. This means that it's more expensive to move products. Over in Kaukauna, we see the New Page issue as they go under. The two reasons cited for them relocating to Mexico were cheaper labor and the cost of moving product. Those are things that we simply cannot afford, and it does not help when the governor takes transportation funds that have been segregated as such and uses it as part of the general revenue pool.
Okay. Obviously, a door to disagreement and difference has been opened here, because I heard Gordon utter the number 39th when you were discussing the
Yeah, we have
tax
one of the
climate.
lowest corporate income taxes in the state, and we're the only state of the upper Midwest states that doesn't have combined reporting, meaning McDonald's and Walmart don't pay any corporate income tax in Wisconsin, but they pay it in Minnesota, Iowa, Illinois. So we actually have advantages. Milwaukee was given one of the lowest business tax climates around. Now, I agree with Mark that on the regulatory side and even on the corporate income tax side, we need to look at it. It's certainly something that's a consideration, but one of our biggest challenges right now is, if you ask businesses, skilled labor. The lack of skilled labor is increasingly the biggest one. We don't have enough educated people to do a lot of the jobs that we have that pay well. And on the New Page situation, we've got a profitable, productive plant that a private equity company bought out that doesn't want to sell it, even though we have 3 buyers. They're going to spend $50 million to close the plant and mothball it, even though we've got companies that want to buy it. I mean, there's an situation where you just have a greedy company that has no consideration, for even selling it, and there's very little that we can do in that regard. In that case, it's awful.
Gordon, you mentioned about combined reporting, and we did a whole show on that probably about 4 months or so ago. And Mark, you had mentioned tax exemptions. Now, there's a situation with the failure to have combined reporting where you do have these companies that are not paying corporate income tax in Wisconsin, even though they're here. If you were elected to the state assembly, what would your efforts be to try and close those loopholes?
See, I'm not convinced that a corporate income tax for the state is actually a beneficial arrangement. Any income tax that you put on a corporation simply gets passed on to the consumer anyway. I think it is important that we attract new businesses. Now, McDonald's and Walmart, of course, are easy ones to hit and say, these ones don't pay the income tax because they will always be here regardless of whether we raise their taxes or not. But on the other hand, if we're closing it for them, then we also will end up closing it on a lot of businesses that are not necessarily mega corporations that are everywhere and will not want to stay in our environment.
But everyone else has to pay taxes. Shouldn't they? Shouldn't they pay their fair share?
Corporations are owned by individuals. Those individuals pay the taxes that they make off of the profits that they make. The corporation itself is a non-entity. It's not a person.
One of the questions is if we did decide that there was significant advantage of not going to combined reporting or even in reducing our corporate income tax load, how are we going to make up the revenue? I mean, right now we're in a place where we have done a lot of exemptions over the last few years, along with some increased spending that have put us in the budget deficit that we have. I've heard a number of people say to me, as we continue to compete against multinational companies, at the national level, we may want to consider reducing or even eliminating the corporate income tax, but that is a significant, it's like a 35%, I think, at the national level. How are you going to make up that same form of revenue, in a similar way? And we all know that any new tax or new fee proposed sort of gets fought on its own merits, not on displacing another revenue. So, it's a conversation worth having. If someone can tell me that, Wisconsin is at a huge advantage for not having combined reporting versus our neighboring states, I'm willing to hear it. But when I first got into office and met with the Department of Revenue, they were sort of saying, our revenue system is like a leaky bucket. And if you saw the numbers the other day at the national level, it seems sort of in the same way. They just simply our departments of revenue don't have the resources to collect all the accounting gimmicks and offshore mailboxes that are getting people to not pay taxes. And of course, the only ones that can't do that are individuals.
Okay.
I would actually add, though, that only about 6% of Wisconsin's total revenue comes from corporate income tax as it is. So that is far and away not one that's going to kill us if we were able to reduce it slightly.
Well, that's true, but it would help. You were
Yes.
talking about
Right.
how it would get passed on to the consumer. I would suggest that things are already being passed on. When there's budget shortfalls here and there, we're seeing it day in and day out, where the consumer is being asked to pick up this tab, and this tab, and that tab, and we're getting tabbed and tapped out as consumers and individual taxpayers. So I don't know, it just seems to me like everyone paying their fair share, including corporations who are here doing business, seems to be the fair thing to do. So, go ahead.
Well, I wanted to shift gears a little bit to a different kind of tax and revenue, and that is property tax, in particular the property tax freeze and its impact on Oshkosh, which once again is, of course, largely the district you represent. I guess to boil it down to brass tacks, I want to ask you guys, do you think the property tax, as it's been in place, the property tax levy freeze, has been fair to the city of Oshkosh, which I think it's fair to say, statistically even, you can pretty much make a case that according to Wisconsin Taxpayers Alliance data, city of Oshkosh isn't one of them big spenders. We've kept it fairly frugal over the years, and when the property tax freeze came in, and was spread across all the municipalities and communities in Wisconsin, one could make the case that it stung worse in Oshkosh We didn't have a lot of revenue. We didn't have a lot of new construction growth to help the city. What do you think? Is the property tax levy freeze and the system we've been living under to cap property taxes locally a fair one, a good one, or not?
It's a mixed bag. The fact is, realistically, what you want is people at the local level representing you that would do their best to live frugally. Unfortunately, what we see at any level of politics is that when left to their own accord, most politicians will simply make more promises to spend and damn the consequences. So in that respect, the property tax freeze is a necessity. And I think that realistically is the bottom line for me.
Would you vote to extend it? If the
I would.
opportunity would. Okay.
And see, I think that's probably one of the big differences here. I can't see anybody that is effectively following what's happening in this community that would honestly go down to Madison and support crippling local control like this. I mean, Alex is right. We're one of the lowest spending cities per capita in the state of Wisconsin. I don't hear anybody saying they want less public safety, which is essentially what you're advocating. Public library cuts, other cuts. I mean, more than 80% of the city's expenditures are for labor. I think they're going to go through a tough budget that's really going to expose this cap for the fraud that it is. Now, one way the caps would work is if we would live up to our obligation to increase shared revenue more than we have in the last budget, which was the first increase in 13 years. Then you would have reasonable reason to not have a reduction in core services that we expect cities to provide. I will say this, I want to come up with a way to get services off the property tax. But again, it's like the corporate income tax, we need to find another revenue. And whether we're looking at increasing the sales tax, which exempts food and medicine, or something else, there are a lot of people living on fixed income who simply can no longer sustain all the decisions they have to make with inflation rising. And we would be smart to attempt to get certain services off of the property tax. Otherwise, you're going to see more proposals like the garbage fee and other gimmicks that try to deal with the caps. And remember, the levy caps brought the garbage fee. That's what you're saying you're supporting, if you support that.
Well, on the other hand, I would also say, though, that the trick with the aid to local government is not so much that we need to find more of it. I think we do if we can. Unfortunately, I don't see that in the budget at this time. But again, it's a deregulation issue. If Madison really wants to help out the local communities, then we should stop trying to mandate the programs and say, if you pick up X program, we will give you Y funding. We should instead change the way we do our allocations for shared revenue. We should perhaps look at a population-based one so that a county or municipality that has a certain number of people will be allocated funds accordingly, and then it becomes the job of those local government officials, the mayor and the town board, to decide how they're going to allocate the funding. I don't think it should be micromanaged from Madison at all.
But you just, by putting a levy cap on there, that's essentially what you've said. You're saying as a state legislator, the state should be telling communities how much they can spend and how much they should pay. And I think local elected officials, should determine how much they should be able to spend. I mean, the question is the only revenue source that we give to communities, the property tax, the best way to pay for local services? And 50 years ago, it may have been a good indicator of wealth, but in 2008, it's simply not. And as the population gets older, it's going to become more regressive. The shared revenue formula did have a per capita component, and that was one of the driving forces. But like the school formula, things cost different amounts in different cities. There are different challenges in communities, and property value is another thing. There's very little policy behind the shared revenue formula now. It's sort of frozen at what you got
and that's
5 years ago.
But then that's an argument to update the formula, not so much an argument that the property tax freeze has to be ended.
Well, can I jump in and ask a question? Maybe to
But
go ahead, Gordon.
I'm only going to say that
Yes, sir.
you're not putting any more money in that pot. We can tweak the formula, but you're going to create new winners and losers. And I guess what I'm saying is you can't have the freeze and expect to have public safety available in Oshkosh, to have a functioning public library and other core services. I mean, the reality is these things cost money, and they cost more money than they did 10 years ago.
Well, any action government takes always automatically creates a winner and a loser. It's one of the reasons that I think we have to be very careful about attempting to pass new legislation that changes the outcomes.
My question was going to get to that point exactly, or at least to that, touch on that point, and that is, come on, guys. I know we were talking about ideas here, but can you tell us that there could be enough inertia in Madison to change a formula, or to restructure the tax system here in Wisconsin, where we do generate a new revenue source? That's been talked about since the days of the Kettle Commission, when we were apparently still scribbling on stones, it seems so long ago. Is there a way to get the legislature to seriously look at changing the way we raise revenue, or the way we calculate it, I guess, even?
Absolutely.
Well, the last, people have heard about the Wisconsin Way Group, which is made up of the teachers, the realtors, not normally on the same side, the counties association, and a couple of other groups have going around the state sort of having this conversation about that. And one of the things at the last meeting in Oshkosh, and it was during one of the rainstorms we had, so attendance wasn't great, but they said, we need to give elected officials the context to be able to make these decisions, and part of it was a big public education component. I mean, property taxes are actually lower today as a percentage of income than they were 10 years ago. That being said, a lot of folks have had stagnant wages. I think they are looking at, where are we low and where are we high, and what's the trade-off? I mean, I've always said we choose the system we have, and I think we're at the point now where if we are going to do real property tax reform, we're going to have to look at a revenue offset. I mean, Minnesota has lower property taxes. They have a 6.5-cent sales tax. We have tax incidence studies that'll let us know, who's likely to be burdened more by that. But it's all about having a real conversation, and if you're having an honest conversation, you need to talk about what real offsets will be. But I think we can do this, and I think we have to do it.
And I would say, incidentally, that I think that is a good alternative to the property tax freeze, is to allow the counties, as we actually do, to set their own increase on the sales tax. The state mandates a 5%, but the county does have the option of going higher. Our county simply has chosen not to do so. We're one of the very few, actually, in the state of Wisconsin that hasn't gone above the 5% state mandate.
Would you support that as a citizen, or as a...
Well, I would leave it up to the local government. If our county feels that it's necessary, then that's on them.
So you leave it up to the counties on that, but not on levy freezes?
Well, the levy freeze still enables the counties to increase the levies every year. It just says they can only do it so much. This means that they have some limits. It doesn't mean that they are frozen.
But well below the inflationary cost for city government.
Cheryl, I'm sure you have another topic to broach here, unless you wanted to dive into.
No, healthcare. Let's go there.
Small issue, right?
Yeah, we can solve that in 40 minutes here. There's going to be an advisory referendum on the ballot coming up, and it has to do with, a state-sponsored type of health insurance. While that's great to get people's opinions, it really doesn't do anything. Do you, either of you, see people in Madison taking the results of that advisory referendum and moving forward with some kind of state-sponsored health care?
Based on the referendum alone?
Yes. Because isn't that the point why we're seeking people's opinions?
We always, advisory referendums are good, but I mean, of course, the decisions on healthcare don't take place in a vacuum, and it's oftentimes more complicated than that. I mean, most times when people are asked if they want some sort of universal comprehensive coverage, they say yes. If you ask them about who should pay and who should benefit and what the conditions should be, there's some disagreement. I think we're at the point where healthcare costs are a tremendous burden, where the market has failed a number of people, where we're going to face long-term costs with the demographics getting older, that if the federal government's not going to act, we should look to do what we can, and incrementally we have expand access. Given the state's fiscal condition, though, and the challenges we face in the next budget, I think without enhanced federal support, it's hard to move forward. I met with Aurora yesterday, And I think the hospital assessment will be back, which will increase reimbursement and reduce cost shifting. And we've seen a significant enrollment in those who qualify for Badger Care and Badger Care Plus. You know, I think more and more people are seeing the need to do something as more and more people are impacted by it. But it's you know, there are consequences to going forward, and there are burdens that we need to watch out for, that, you know, unintended consequences of moving ahead.
Yes. Well, I would start out by saying that I'm not actually convinced that a state-sponsored for everyone healthcare proposal is a valid option, not only economically but or politically, but simply ethically. Why is it that we feel that anyone is specifically entitled to healthcare without necessarily doing anything? For the last 60 years, the model in our country has been that he who works has health care. With the Badger Care program, we extended it initially to children and parents of those children that were unable to work, and I have no serious issues with that. However, and the Badger Care Plus program expanded it to a group that was working but simply were lower income. I don't have too many issues with this. However, the last part of the group that was included in the Badger Care Plus program were able-bodied adults who I cannot see a reason why they shouldn't be told that they have to go find a job to cover their own health care, or alternatively begin paying for their own. I think if we want to keep our health care costs down, it needs to be market-driven. We need to look at the HSAs. We're one of only 4 states left that does not allow a write-off at the state level for it. I think we need to look at allowing a statewide pool for small businesses so that they can begin getting health care for all of their folks, rather than small businesses right now not being able to afford health care because they are such a tiny pool.
I mean, one of the problems we've seen is that employer-provided insurance has dropped significantly, and a lot of times we see people that would otherwise like to take a new job or become entrepreneurs stuck in a dead end. How many people do you know that are stuck in a dead end job that they hate, but they've got a family and kids, and there's no, we curb entrepreneurship and people taking challenges and creating new businesses because of our system that's dependent on that. And what we've seen replacing a lot of the employer-provided pooled coverage plans are these high-deductible plans, which are good if you're healthy and you're not going to get sick, but they discourage preventative care, which drives up long-term costs and prevents people from going to the doctor. And there are just way more people, even than when I first ran 4 years ago out there, that have had a system that has failed them greatly. And again, a lot of times it's because they're either unemployed, they've lost their job, they're 55, 59. On doors, this is one of the biggest things you come across, is someone who the system has failed and will not provide insurance to them, and we all pay for that. The number of people that are uninsured, they end up having to go to the doctor. They usually go to the doctor when it's too late, and they go to the ER, and you pay for it, and I pay for it, and we all pay for it. When I hear that Toyota is opening a new plant in Canada because U.S. healthcare costs are too high, I realize that it's also a business disadvantage.
Well, I'd actually argue that one of the reasons that there's actually many reasons that Toyota did that, aside from healthcare. There's the fact that when Toyota opened that plant a few years ago, the Canadian dollar was significantly weaker than the American dollar. The fact that in Canada, the average wage of workers is significantly lower, and so therefore they were able to cut costs in that area. There's also the fact that Canada has a lot of legal reforms, tort reforms, so that they don't have to worry about being sued nearly as badly for nearly the amounts that they do here in America. So I think to say that it's simply a healthcare consideration is disingenuous, especially when, with the NAFTA treaty that we have in place, they are able to bring the product over. It's part of that globalized economy issue.
Now, what about Healthy Wisconsin? That's another a separate effort, but seemingly a good one, which it simply says that everyone in the state who's a resident will be entitled to the same kind of quality health care that you folks in Madison get.
Call it crazy.
And it is, you know, the premiums, if you will, are based on your income and your employer's income. And if you're self-employed, then there's a different structure for that. There is a situation where it's not being given to someone free. What's your position on that?
Well, my understanding of the Healthy Wisconsin plan is that while people are in fact paying for it, the people that are being insured are not necessarily the ones paying for it. If I recall the information on Healthy Wisconsin correctly, anyone who's had residency in the state for over a year becomes eligible regardless of employment status. So I do not think it is in fact it's being provided for free to that individual. But this does nothing to provide for personal responsibility in spending or at all worrying about their health care. One of the things I think actually we need to consider, especially in, say, the Badger Care programs, is not so much that we need to expand it and make it cheaper. We actually need to look at attaching a constant deductible of some sort to it. At the moment, the Badger Care standard program starts out at 50 cents and moves up to $2. This doesn't do very much at all to convince people that, you know, perhaps they should sit out the head cold or not worry about the temperature that doesn't break 101 degrees. Because after all, if it's only going to cost you $2, why are you going to economize it all? And after all, since you're not paying for it, the taxpayer is, then you can go and do that $100 doctor's visit, pay your $2 copay, and be on your way. So I'd say that Healthy Wisconsin does nothing to really address that kind of a problem at all. So in that respect, it doesn't do anything to cover cost of health care. I'd also say that the Healthy Wisconsin plan is broken because it has rates set by the Healthy Wisconsin board in the proposal as it was listed. The board consists of union members, big business members, a few legislative advisors. There's really not one person in the list that they have that has anything to do with healthcare. There's not one hospital administrator. There's not one doctor included. There's not one nurse included. All the people that actually know healthcare, from the providing of it to what it costs, are left out. And I think that makes it more of a gimmick than an actual serious proposal.
Now, there were some revisions that just came down in March, Gordon. You know, do those revisions address any of Mark's concerns?
I mean, there are some plans in there, and this was a Senate-sponsored plan, so, you know, I mean, I saw the details like everybody else did, you know, that did try to put some healthy incentives for people taking care of themselves. You know, there were co-pays in there. The main goal, you know, Healthy Wisconsin was a real, serious plan. It got national attention. It tried to address the cost shifting that goes on. I mean, our local governments can pick up a considerable amount of costs for other employers who don't provide insurance for spouses. It does address cost, access, quality, freedom of choice, you know, things that we would like to see in a health plan. But, you know, and they did, to their credit, put funding details in there. To me, the biggest problem with it was unfair to a lot of small businesses, which are really the backbone of the economy. It was hard to talk to restaurant owners here about it and other small businesses and say, you know, are those margins, you know, real for you? And the answer is no. It was very hard. And so they try to tweak some of the things with maybe, you know, because new businesses often lose money for a number of years before they get going, and that added labor cost was significant. That being said, you know, after 14 years of leadership in the Republican Assembly, we haven't seen a single health plan that did anything to address access or you know, cost really for everybody. So I give them credit for putting a plan forward. I think the healthcare debate has advanced, but we have to get away from, and I think Mark is right in that we need to talk more about health. We kind of have the two sides, you know, socialized medicine and then, you know, individual health savings accounts, and really we need to start talking about health. I mean, you guys have done a series on drinking. I think there's been more attention on the smoking-related impacts, tobacco-related impacts to costs. We do need people, we need, you know, childhood obesity is going to lead to an diabetes epidemic. We do need to get back to health, and we're always going to deal with some cost, access, and quality issues, but you know, and both sides have come together on some of those, but sometimes the polarizing debate, I think, does ignore the health issue, as Mark mentioned.
Sure. Mark, you had mentioned on your website, in fact, you wrote, governments are established to ensure the rights of all its citizens, from the most powerful and wealthy to the least noticed and poorest. Wouldn't that be a terrific reason to have some kind of a statewide health initiative? And again, I'm not talking about something that's just provided free to anyone who doesn't want to pay or doesn't want to work.
Fundamentally, what it comes down to is whether we consider health care to be a right. I am not convinced that it is. I believe that health care is something that we earn. The same way that you have no right to a job. If you are able to achieve one, that's good. And it means that you have done well. But there's no fundamental right to any of these things.
Well, I guess that's where we differ.
Yes.
Well, and I mean, one of the realities of that, though, is, I mean, a lot of times you're talking to people that are predisposed to cancer or have a catastrophic accident. I mean, 5% of the public is responsible for more than 50% of the healthcare costs, oftentimes through no, cause of their own. And I do think we have an obligation. We certainly do a lot of other things in society, and our value system does say that we're going to provide government services. I mean, we decide that it's important to have public education, educate everybody, those with special needs, those that have other disabilities. Other countries don't. They say it's not a right. And so I think you could say that sometimes the healthcare debate should be analogous to that, and I think our value system does say we at least have make sure everybody has access to healthcare.
Well, that gets into a question, though, of the differentiation between society and government. For instance, we have in this area Mercy Medical Center, run by the Catholic Church. The Catholic Church always believed in providing for everyone. Long before there was such a thing as hospitals for profit, they were there providing health care for our community because they believe in it. That was a decision made by them as a society, and the community supported it. When government steps in and decides that it's going to take over that role, it tries to replace itself with society, and the two are not synonymous.
I want to go back for just a minute, and then I'm going to let Alex take a whack at something here, whether it's this or something new. But you had said, Mark, that you don't consider health care a right. What would you consider to be a right?
Well, anything that's outlined in the Constitution, obviously, although I would also add to it that we know that there are many rights that are not enumerated. This is also part of constitutional law understanding. But fundamentally, health care is a commodity. It is provided for from one private citizen to another private citizen. In that respect, it is not the same as freedom of speech, which you are able to activate entirely on your own to whomever you choose, so long as certain restraints are in place. And this is the difference between a right and an earned privilege.
Okay.
On healthcare, actually on health more generally. Two proposals that might come the way of the legislature next session, maybe the session after, I don't know. First one we've already heard about, statewide smoking ban. I'd like to know where both of you stand on a statewide smoking ban. And secondly, getting back to our Gannett, Wisconsin series on the state of drinking in Wisconsin and the including the incredible toll alcohol can have on our health care and our health as a state. Would either of you support an increase in the state beer tax, given the fact that it has not really nudged since, I believe, the 1960s, was it? Late 1960s. So, beer tax, statewide smoking ban, where do you stand?
I do not believe in a statewide smoking ban. I believe municipalities should have that right. Again, it should be a local control issue. It's bad for the people that happen to be in those municipalities generally that pass those bans, and I think that's something that those city councilors should take into account when they make those considerations. But I do not consider it to be a public health issue. I consider it to be a property rights issue. Here in town, we have Jansen's, a bar that has decided to go smokeless. They do quite well for themselves. And it's kind of a minor plug for them, I suppose. But anyway, this
a few
tells us
places
that,
like that.
yes, that tells us that there are places that have decided to make that take that option. But that's because they, as owners, made that decision. I do not think it should be made by anyone else. And if it does get made, it should be a decision made at the most local level possible. As for the beer tax, I would, again, not support increasing it, not because I don't believe that alcohol occasionally has a terrible toll, but because, again, to me, it's an industry issue. And also a issue of personal freedoms. Simply because we don't necessarily like all of the outcomes does not give us a right to attempt to ban them. We cannot legislate morality.
On the smoking ban, the reality is that we have a hodgepodge of bans around the state, and having some uniformity is one of the things. I mean, the number of businesses in town, restaurants, that are saying, would you please pass a smoking ban so we can compete on equal ground with the bars, because of the 80% threshold in our ban is something that I hear from every day. Now, I meet with the Tavern League, and they tell me otherwise, and I'm respectful of the slippery slope of government. But the smoking ban issue is a public health issue, and government gets involved when there are public health issues. And it's not about the person. We're not going to ban smoking. It's about the secondhand smoke, which drives up costs, which leads to bad health outcomes, which kills people, according to the Surgeon General's report. We have an obligation, certainly, to discourage smoking, but we're not going to ban it altogether. Some states have moved further along. I think this is one of the things that, if we're serious about reducing healthcare costs, we'll look at. In the state of Wisconsin, we spend $2 billion a year on tobacco-related illnesses, with taxes going to about $500 million of Medicaid expenses are to treat tobacco-related illnesses. So you can't say you're for less government without looking at ways to discourage and use incentives for preventative health. I'll say this about the beer tax. In a state like Wisconsin, you're absolutely right. I mean, hey, I support the beer tax isn't going to get you a whole lot of votes. It's simple. People understand it. People like to drink beer. They don't want you increasing it. Also, one of the ways it may come up, there's a lot of push for something else you guys talked about, making third offense drunk driving a felony offense. And there's a lot of support for that. But they just ask you if you want a third offense felony. Well, the question should be, are you willing to raise the $200 million in revenue it would take to fund our increased court system, bog down, and build the additional prison space that we're going to need to fill it up with those people that are going to be in there? And maybe the beer tax is how people that want to support that, change in law will pay for it. I don't know. My guess is they'll just pass it without providing any revenue. But a more honest discussion would include money to pay for a new expense.
And see, I believe that it draws kind of a false analogy to say that all drunk driving is caused by all beer drinkers, and therefore all beer drinkers should be paying for a beer tax. And I would say that we need to crack down harder on drunk driving. There are a number of options on the table, and I think third-time felony is very possibly a good one. However, I would also agree that we need to look at the alternative sentencing options. Treatment is far better when it can be done and when it works than locking someone away and making them a non-productive drain on society.
What about an increased tax then on all alcoholic beverages, not just beer?
I mean, I think Mark's right about the point that, I think there was a bill this year to pay for, moving 17-year-olds back to juvenile court, and they were going to tax video games to pay for it. And the question was, well, why are you going to penalize the people that purchase video games? I think there should be a nexus, and he's right about beer drinkers. Again, I'm not advocating for it. I'm just saying if you are going to propose changes in things like drunk driving laws, and it is going to cost an underfunded court system, money, then maybe those kind of options are on the table.
Mm-hmm.
I think, the cigarette tax was opposed for years, and it got some traction as there's been public education on the cost to our taxpayers and to the healthcare system that smoking has.
What can Wisconsin do to avoid the major embarrassment that was the delayed budget of 2007, the biennial budget? What can the legislature do to put in controls that make sure that never happens again? Because I think a lot of people who were watching that fiasco were very disappointed in the legislature and the dynamics of Madison and why we couldn't get a budget done to line right up with the expiration of the last biennial budget?
I think, electing a Democratic majority to the Assembly would be a good start.
What a coincidence.
Yeah, well, we got
putting Republicans in both houses would probably solve it right away.
Yeah.
I expected that
Look, part of it was gridlock, but it was disappointing on both sides. And I was part of a bill with Representative Nelson that tried to put some incentives in there for us to meet, including, once the budget is delayed, actually making us go to Madison and sit and meet and work on it. And if we don't get it done by a certain day, start docking our pay. I mean, it was ridiculous that we were putting so many services and jobs close to the deadline without doing it. And the other one, which has been introduced as separate bills in the past, is to ban fundraising during the process. When there's significant state programs that interest groups are invested in, they want outcomes that benefit their policies and their stakeholders. We should be taking that off the table even for the perception issue alone to restore public trust. But we also, when we have to have a real conversation, and I think Mark and I are in agreement on, better balanced long-term funding, a real conversation about, passing one of these next budgets with a plan to reduce and eliminate the structural deficit and have an honest conversation about what programs cost. The legislature made a decision to give free tuition to veterans, and the Republicans budgeted $0 for it, and then the Democrats budgeted half the money for it. Well, guess what? Every student that goes to UW-Oshkosh this fall is going to pay $250 more in tuition to pay for that program that the state got a lot of headlines out of but didn't want to pay for.
Yeah. I think a large portion of the problem we have in Madison is that with normal people, budgeting works as if you and Cheryl, for instance, had a disagreement over how to spend $100, you would eventually come to a compromise that would give each of you roughly $50. In Madison, the trend seems to be more towards each side getting $55 and then grumbling as they walk away that they got screwed. And this is problematic. I think what we need to look at first is how we have figured out our budgets for the last few years. We begin with an unrealistic expectation of growth on virtually all of the budget bills. Even when Legislative Bureau is giving out good numbers that approximate roughly where the increases are going to be and how much they're going to bring in, legislators then choose to ignore them and use the numbers that are convenient for them. And that has to stop. Once everyone is on the same page as to the amount they actually have to work with, then I think you might see a compromise occur faster, because you won't have these fictitious numbers that people choose to pass around.
Okay. Dan's not here, obviously, but he did send along some questions.
Oh, that's unfair.
And one of them was, there's a feeling out there that the general election will favor the Democrats. Do you agree or disagree with that? And I know where each of you is going to fall on this question, but
Maybe.
go for it anyway.
That's all he's got?
No.
No, he sent others. He sent others.
I'll say this. I mean, one thing Wisconsin's shown, and I was the first Democrat elected from Oshkosh in 25 years, and I know I've gotten crossover support, from people that I've talked to. Wisconsin's a pretty independent place. When you have a Bill Proxmire here, when you've got Bob LaFollette, when you've got a history of people, Russ Feingold, who also gets crossover support, that you can't really predict that we're going to follow the national trend. I do think that there is, an opportunity here. Senator Obama certainly did well in the primary here, and there's a lot of excitement, I can tell you, down at our campaign headquarters. But everybody's going to have to make their own individual decision. I mean, I've talked to people that are voting for McCain and that are going to vote for me, but I'm hopeful that people know that the last 8 years have been a major failure at the national level, and the best new directions to go is with Senator Obama.
Well, I think that on the whole, it may be a good year for Democrats in the statewide. I am not convinced that is the case in Winnebago County or Oshkosh specifically. From what I've been seeing while I'm knocking on the doors, McCain does have a decent amount of support. Of course, there's still a few people that as soon as I say Republican slam the door, in a few cases have cussed me out. But that's the exception. By and large, I tend to agree that Wisconsin is a very independently minded state, and whether they vote for McCain or Obama, they will not necessarily go straight ticket on that ticket. And I also think that McCain is going to do far better than people anticipate in this area.
What, as far as your own race goes, what would a Republican victory for you mean for the people here in the 54th Assembly District?
Are we saying if I win or
Yes.
Republican victory as a whole? Okay.
Well, either way.
Yeah, the things I'll be pushing for are what I started out the discussion with tonight. First thing, I think we absolutely need to balance this budget. We've got an $8 billion debt now. That's unacceptable. We cannot maintain that. Wisconsin's one of the higher tax states in the country. That means we're trying to do too much. We are trying to be all things to all people, and that is not possible. So I think we need to seriously look at budget cuts, and I'd love to say that we could lower taxes. It's a standard Republican talking point, but in my case, I'd say no. We cannot look at doing tax cuts until we cut the programs that we don't need or are simply too cost ineffective to be kept, and make sure that we can pay off that debt. Second thing I think that I'd be leading for is development of energy independence. And in this case, the windmills, we need to keep doing them, but they are not perhaps the most cost-effective way to go. I think what we need to look at is going to nuclear, and not just the standard nuclear everyone else is talking about, or that Governor Doyle is talking about, where he's talking that we may want to do it, but we will not be the leader. I think Wisconsin absolutely should be the leader in it. What we should be looking at is actually the fourth-generation nuclear program. Department of Energy has been researching it for over a decade. They have all the plans laid out. They have not built a prototype. What this means, and they do want to have one built by 2020, what this means for Wisconsin is we could be in on the ground floor. We volunteer to take those plants. We get the prototype, we get the production lines here, all over the 54th and the surrounding area. Bring in the jobs, start a production line, then we become the primary supplier for this product nationwide and worldwide, because everyone is going to want to go to these systems once they're online.
Okay.
Gordon, nuclear energy in the 54th? I got to know what you'd say about that.
Well, I mean, the two things that are stopping us from lifting the moratorium, and even if we do lift the moratorium, are cost and disposal issues, and we haven't come up with ways to deal with nuclear waste. I do think there is more environmental support and more people that are open-minded to this, and I think whether it's nuclear or other forms of energy, it is a tremendous economic opportunity as a state, and we are going to have to push for that, and I will certainly be a part of that. What people that are considering nuclear have to understand is the second backup site to Yucca Mountain in Nevada is northern Wisconsin, and we have to say, are we willing to store the waste if we're willing to produce it? And I think some people might be hesitant on that based on the number of contacts to my office that were hesitant. That being said, we need to look at all considerations on the table. I will say, priorities for me, Mark's absolutely right. Anybody who's coming into office next year at the state level is going to be getting handed a dog in terms of a budget. It is tough times right now. There is a role for government to play. My priorities are going to be with the community here in terms of investing in people's future through public education, the Oshkosh School District, keeping tuition affordable at the university system, and trying to grow the economy long term. But we certainly have our work cut out for us, but it's important that we do what it takes to keep our priorities.
Okay. All right. On that, we're out of time, but thank you both very, very much.
Thank you.
Appreciate
Thank
you
you
being
very
here.
much, ma'am.
Alex,
Thank you,
thank
sir.
you.
No problem.
And we'll see you next time. Until then, take good care. Keep your eye on us. We've got All Right on Oshkosh.